In this video, we'll explore the important question of where palliative care can actually be provided. First of all, palliative care can be provided in a hospital setting, that is, as an inpatient, a day patient, or on an outpatient basis. It can also be provided at home with the support of a pediatric palliative care team or in a children's hospice. It all depends on what's important to you and on what is reasonable and possible. And what's very important is that no matter what you decide, your pediatric oncology team will, in any case, continue to be there for you. Because palliative medicine, nursing, and psychosocial support are also part of oncological care for children. Most oncological centers usually have doctors and nurses who are specially trained in palliative treatment and support. But that's not all. In addition to the hospital team, there's other support available. Most pediatric oncology centers work closely with the local so-called SOPPC teams. The abbreviation SOPPC, or sometimes SAPVKJ in German, stands for Specialized Outpatient Pediatric Palliative Care, which provides comprehensive care. Since that term is pretty long and complicated, we'll put it on the screen for you again here. Okay, and now it would probably also be helpful to know what or who is actually behind this abbreviation. It's a dedicated and specialized team of doctors, experienced nurses, and skilled psychosocial staff who visit you at home, provide thorough medical care, and offer important psychosocial support. In several countries, all children and adolescents with an advanced life-threatening or life-limiting illness are entitled to this form of specialized support. This means that today, most people who wish to can be very well cared for in their own homes, right up to the end. So, how exactly does it all work? First, the pediatric palliative care team gets to know you as a whole family, to understand your wishes and to be able to provide the best possible care for your child. The focus is on slowing the progression of the illness and, if necessary, alleviating distressing symptoms, thereby enabling as much quality time as possible. Hospital stays can also be reduced, wherever possible. As I mentioned, the SOPPC team also includes doctors who, for example, are able to write prescriptions. This provides a level of medical care that an outpatient nursing service might not be able to offer. In addition, the team offers a 24-hour on-call service. They will discuss important arrangements with you for how to proceed in emergencies and crises, and these will be updated regularly. It may be that for a long time you only rarely need visits from the pediatric palliative team, and at other times the care is more intensive. Also, whether you're more in contact with the clinic team or more in contact with the pediatric palliative team, that can vary a lot, depending on your personal situation. There can be different phases. But both teams exchange information, yes, so that at all times, wherever you are, you get the help you need. And what the right environment for palliative care is for your family, that can of course change, depending on how your child is doing. And that's not something you can really plan. Maybe your child wants to maintain their familiar routine at first, and continue going to school. Or maybe you want to travel together or just rest and do as little as possible. Often, it only becomes clear during the process which place is right for your child and for you at which time, and which palliative care best suits all of you. Another option can also be a children's hospice. There, chronically and seriously ill children, as well as oncology patients, are cared for with a great deal of expertise, time, and support for the entire family. This can happen over a longer period of time or just in phases. By the way, this is also possible when the young patients are still doing quite well, in case families need that special support during certain phases. What you have to keep in mind is that such children's hospices are not available everywhere. But maybe one that's a bit further away is an option for you. Because in almost all facilities, parents and siblings can be admitted as well by arrangement. But maybe you'll also feel more comfortable and secure if the care takes place in the children's hospital you and your child are already familiar with. Some families find that this is the best option for them, even in the final phase of life. In this case, the therapeutic team will be guided by your personal wishes and needs during this special time. By the way, palliative care units are rather rare in pediatric oncology. This means that inpatient care usually takes place on the regular oncological home ward, the one you're already familiar with. And always remember, you don't have to decide right from the start, because you'll always have different options, depending on how the journey for all of you unfolds and what feels best for you and your child. Short-term relocations to a clinic, back home, or to a hospice are also usually possible. And remember, you're not on your own when it comes to making these decisions. The teams that support you will do everything in their power to guide you and address the needs and wishes of your child and your family as best as possible.